G'day everyone. Dr. Zoe Mitchell here, and today we're going to have a chat about something that's bloody important for all you blokes out there, especially those of you who've clocked over 60 years. Now, before you click away thinking this isn't for me, I want you to stick around because what I'm about to share with you could literally save your life. Did you know that men who ejaculate 21 times a month have about a 30% lower risk of developing prostate cancer? Yeah, you heard that right. And today, I'm going to break down the science behind this, answer some of the most common questions I get in my clinic, and give you practical advice you can actually use. I've been practicing medicine for over 20 years now, and if there's one thing I've learned, it's that blokes are often too embarrassed to ask about this stuff. Well, not today, mates. Let me start with the basics, because I reckon a lot of you have heard about the prostate but might not know exactly what it is or what it does. Your prostate is a small gland, about the size of a walnut, that sits just below your bladder, wrapping around the tube that carries your urine out. Its main job is to produce a special fluid that makes up about 30% of your semen. This prostatic fluid contains important substances like zinc, enzymes, and something you've probably heard your doctor mention during checkups, PSA, or prostate-specific antigen. That's the blood test they do to check for prostate problems. Now, here's something that surprises a lot of blokes when I tell them. When we talk about ejaculation, most of the semen doesn't actually come from your testicles like many people think. Your testicles only contribute the sperm, which makes up just 1% of the total volume. The rest comes from your prostate, and these glands called seminal vesicles. So when there are problems with your prostate, there can also be changes in ejaculation. This is completely normal, but it can be worrying if you don't know about it beforehand. Right. So let me share something really interesting that scientists have discovered in recent years, and it's caused quite a stir in the medical community. Several large studies, including one really important one that followed more than 30,000 men for nearly 20 years, found something quite remarkable. The researchers observed that blokes who ejaculated more frequently had a lower risk of developing prostate cancer compared to those who ejaculated less often. Specifically, they found that men who ejaculated 21 times a month or more had a significantly lower risk than those who only did it between 4 and 7 times a month. Now, that's fair dinkum science, folks. But here's the most important bit, and I want you to pay close attention. Don't go worrying yourselves thinking you've got to hit a specific number of ejaculations per month. The science hasn't established an official recommendation on exactly how many times a man should ejaculate to prevent cancer. Every person is different, and what's normal for one bloke might not be for another. The frequency depends on heaps of factors like your age, your general health, whether you've got a partner or not, and simply how you feel day to day. Scientists have several really interesting theories about why frequent ejaculation might protect against prostate cancer. One idea is that when you ejaculate regularly, you're flushing out substances that could be harmful and would otherwise build up in your prostate. It's a bit like when you regularly clean out your gutters so they don't get clogged, right? If you let too much debris accumulate, eventually you're going to have problems. Another theory is that regular sexual activity helps maintain a healthy hormonal balance and improves blood circulation in that whole area, which is very beneficial for overall health. We've also seen that regular ejaculation can help with other prostate problems that are really common in older men. For example, many blokes your age suffer from chronic prostatitis, which is inflammation of the prostate that causes discomfort when urinating, pain in the area between your testicles and anus, and sometimes even lower back pain. A really interesting study found that men with this problem improved their symptoms when they increased their ejaculation frequency, whether through sexual intercourse or through masturbation. And I want to be crystal clear here, masturbation counts too, and there's absolutely nothing wrong with it. It's a normal and healthy activity at any age, so don't feel embarrassed if it's something you do. Now, I get asked this heaps by my older patients. Is there any connection between sex and sleep? Well, turns out there is. A recent study from 2023 found that people who had sex a few hours before bedtime slept better and more deeply. So apart from the pleasure it can bring, sexual activity can have other important benefits for general health, including better rest at night. Not too shabby, eh? I want to take a moment here to answer a question that one of my patients asked me just last week, and it's something I see in the comments all the time. This bloke, 70 years old, told me he'd had prostate trouble back in 2017, was on medical treatment for 6 months, but it never really sorted him out. He couldn't urinate properly, couldn't have a bowel movement, and the doctors said he needed surgery. But he was worried they'd muck him up, so he found a natural remedy instead. He took it for 6 months, and the problem went away. But now, even though the prostate issue is gone, he can't get an erection anymore. He asked me, "Is there anything you can give me that'll help? I'm 70 years old and I still want to have relations, but I just can't get it up." Mate, if you're in this situation, you're not alone. This is incredibly common. First thing I'd say is, go see your GP or a urologist for a proper assessment. There could be several things going on. It might be related to the natural remedies you took. Some herbal supplements can affect blood flow or hormone levels. It could also be related to the prostate inflammation itself, which can damage nerves and blood vessels in that area. Or it could simply be age-related, because testosterone naturally declines after 50, and many medications we take for blood pressure, diabetes, or heart problems can affect sexual function. But here's the good news. There are treatments available. Medications like Viagra, Cialis, or Levitra can help many blokes. There are also other options like vacuum pumps, injections, or even penile implants if tablets don't work. Some men benefit from testosterone therapy if their levels are low. The key is don't suffer in silence thinking there's nothing that can be done. There's always something we can try. Another question I get asked a lot is about natural remedies. Someone asked, "Is peppermint and chamomile tea good for the prostate, or do you just drink it to sleep?" Well, let me tell you what the science says. Chamomile tea is brilliant for helping you sleep because it has natural calming properties. Peppermint can help with digestion and has anti-inflammatory effects. But specifically for prostate health, the evidence is pretty limited. They won't hurt you, and they might help you feel better overall. But don't rely on them as your main treatment for prostate problems. If you want to talk about natural remedies with some actual scientific backing for prostate health, here's what I recommend. Tomatoes are fantastic because they contain lycopene, which has been shown in studies to benefit prostate health. Eat them cooked if you can. The lycopene is more easily absorbed that way. Green tea has compounds called catechins that may help. Foods rich in omega-3 fatty acids like fish, especially salmon and sardines, can reduce inflammation. Pumpkin seeds are packed with zinc, which is crucial for prostate function. And if you're into herbal teas, saw palmetto is one of the few that actually has some decent research behind it for prostate symptoms. Though always check with your doctor before taking it, especially if you're on other medications. But let me be absolutely clear. None of these natural remedies should replace proper medical care. If you've got prostate symptoms, you need to see a doctor, get proper tests done, and follow medical advice. Natural remedies can complement medical treatment, but they're not a substitute. Right, let's talk about something that's really important for many of you: prostate surgeries and how they affect your sex life. When your prostate grows too large and causes problems with urination, what we doctors call benign prostatic hyperplasia or BPH, sometimes surgery is necessary. In these surgeries, we remove the part of the prostate that's blocking urine flow, but we leave the outer capsule. After this operation, many men experience something called retrograde ejaculation. What does this mean? It means that semen, instead of coming out through your penis like it normally does, goes backward into your bladder. This isn't dangerous at all, but it can be quite disconcerting if you're not expecting it. You'll still feel the orgasm just the same, but you won't see any semen come out. It's important to know this before surgery so you're not freaked out afterwards. It's different when we're talking about prostate cancer and the surgeries done to treat it. If there's a malignant tumor and surgery is necessary, we remove the entire prostate completely in an operation called radical prostatectomy. After this operation, you won't produce semen anymore because you no longer have a prostate. Additionally, there can be other consequences like problems controlling urine or difficulties with erections. That's why it's so bloody important to detect cancer early when there are still more treatment options that don't require such aggressive surgery. Someone also asked me about blokes with disabilities. specifically those with cerebral palsy, and what they should do about sexual health. This is a really important question that doesn't get asked enough. Mate, having a disability doesn't mean you don't have sexual needs or desires. Everyone deserves to have their sexual health addressed. For people with cerebral palsy or other disabilities, there can be physical challenges, but there are also solutions. Occupational therapists who specialize in sexuality can help with positioning and adaptive devices. Sex therapists can work with you on techniques that work for your body. Some people benefit from working with a support worker who's trained in intimate care. The key is to speak openly with your healthcare team about what you need. Don't let anyone make you feel like your sexuality doesn't matter because of your disability. Now, I also saw someone asking if it's true that the penis can grow or get longer after 50, or if that's just marketing rubbish. Let me be straight with you. Any product claiming to significantly increase penis size, especially after 50, is pretty much bollocks. As we age, the penis can actually appear smaller due to weight gain around the pubic area, or because of reduced elasticity in tissues. Some medical treatments for erectile dysfunction can help you achieve your maximum size potential during erections, but they don't actually make you bigger. If you've lost some function due to health issues, treating those underlying problems might restore you to your previous size. But genuine enlargement? That's not happening with pills or creams, mate. Save your money. Let me tell you something really important about preventing prostate cancer that everyone needs to know. Although frequent ejaculation might have some protective effect according to these studies, it's not a guarantee and shouldn't be seen as the only preventive measure. The most important thing, and this is official medical advice, is to get regular checkups. All men over 50 years old, or from 45 if you've got close relatives with prostate cancer, should get a PSA blood test and digital rectal exam once a year. I know the rectal exam isn't pleasant and many blokes avoid it out of embarrassment or discomfort, but it's a quick examination that takes less than a minute and can save your life. It's also fundamental to maintain a healthy lifestyle to reduce the risk of prostate problems. Smoking is really harmful, not just for your lungs but also for your prostate. Obesity is another major risk factor. Eating lots of red meat and not enough vegetables increases your risk, and not exercising is another problem. I recommend walking at least 30 minutes a day. It doesn't have to be intense exercise, just a gentle walk around your neighborhood or at the park. Eat fruit and vegetables every day, especially tomatoes that contain that lycopene I mentioned. All these traditional healthy foods we should be eating anyway are really good for you. Many blokes tell me they don't feel the same sexual desire they did when they were young, and they wonder if that's normal or if something's wrong with them. I want to tell you that yes, it's completely normal for sexual desire to decrease with age. Testosterone levels naturally drop after 50, and many medications we take for high blood pressure, diabetes, or heart problems can affect sexual function. The important thing is not to pressure yourself or feel bad about it. If you've got a partner, talk openly about it. Communication is fundamental. Intimacy doesn't always have to include penetration. Hugging, caressing, kissing, holding hands, all of that is also important for maintaining physical and emotional connection with your partner. For those of you who live alone, who've been widowed, or for whatever reason don't have a partner, I want to tell you that masturbation is still a perfectly healthy option. There's no age limit for sexual pleasure, and, as I've already mentioned, it can be beneficial for your prostate and general health. If you're having difficulties with erections, don't be embarrassed to talk to your doctor. There are treatments available that can help, from tablets to other methods. The important thing is not to suffer in silence thinking there's nothing that can be done. I also want you to be aware of certain symptoms that can indicate prostate problems. If you notice you're getting up many times at night to urinate, if your urine stream is weak, if you feel like you're not completely emptying your bladder, if you have to push hard to urinate, or if you feel a sudden urgency to urinate and can't hold it, you should see your doctor. These can be symptoms of prostate problems that need medical attention. Don't ignore them thinking it's just part of getting older. It's important you know that 80% of men who reach 80 have some degree of prostate enlargement, and many will develop prostate cancer if they live long enough. But don't panic about these statistics. Most prostate cancers grow very slowly, so slowly that many men die with prostate cancer but not from prostate cancer. In other words, they die of other causes before the cancer causes them serious problems. That's why regular medical follow-up is so important to determine which cases need aggressive treatment and which only need careful observation. Another thing I want to mention, I see in the comments that one bloke shared his routine of drinking ginger and turmeric tea, sometimes mixed with watermelon, dandelion tea, and clove tea. That's brilliant, mate. These are all anti-inflammatory foods and drinks that can support overall health. Turmeric, especially, has strong anti-inflammatory properties due to its curcumin content. Ginger's great for circulation. Dandelion can help with liver function. But again, while these are excellent additions to a healthy lifestyle, they shouldn't replace medical care if you've got actual prostate symptoms. Remember, folks, sexual health is an important part of overall health and quality of life. Don't be embarrassed to talk about these topics with your doctor. If you've got doubts about your prostate, your sexual function, or any changes you notice in your body, consult with a health professional and be really careful with what you read on the internet or what your mates tell you down at the pub. There's a lot of incorrect information floating around out there. There are no magic diets or miracle supplements that cure or prevent prostate cancer, even though many products are sold with those promises. To wrap things up, I want to leave you with these practical tips you can start following today. Maintain whatever sexual activity feels comfortable and pleasurable for you, without pressuring yourself about numbers or specific frequencies. Get your prostate checkups regularly, even if you feel fine. Maintain a healthy lifestyle with regular exercise and good nutrition. Don't smoke if you still do. Keep your weight under control by staying active. And talk openly with your doctor about any concerns you have, without shame or fear. Your prostate is a small gland, but it's really important, and taking care of it is part of taking care of your overall health. Remember that getting older doesn't mean giving up on pleasure or intimacy. Every stage of life has its own joys and challenges, and with correct information and adequate medical care, you can enjoy a good quality of life for many more years. Don't let fear or embarrassment stop you from seeking help when you need it. If you're over 50 and haven't had a prostate check in the last year, book an appointment with your GP this week. Seriously, do it now. And if you've got mates who are in the same boat, share this information with them. We blokes need to look after each other and stop being so bloody stubborn about our health. I hope this information has been useful and helps you understand your body and your health better. If you've got specific questions or concerns that I haven't addressed today, drop them in the comments below and I'll do my best to answer them. Or I might even make a follow-up video addressing them. Share this with your father, your brother, your mates. Because everyone needs to be informed about their health. Take care of yourselves, get those annual checkups without fail, and remember that prevention is always better than treatment. Until next time, this is Dr. Zoe Mitchell reminding you to look after yourselves and each other. Cheers, everyone.